issue that we're talking about today that got me off my sofa and into this race in December against just a few short weeks in the legislature when Governor Blunt decided to cut hundreds of thousands of people off health care, including children. It was a rude awakening for me in my very beginning of my political career. I vowed then that I would dedicate myself to making sure we restored those cuts and provided affordable access for every American. The other event that was defining for me was the day of the attempted congressional override of the children's health insurance bill just late last year. I watched the vote with optimism that Congress would find the needed votes to override the President's veto and expand children's health insurance coverage to thousands of children. Unfortunately, along with many people, I was disappointed to see that my own congressman voted against the bill. That's all it took. I knew we needed change. It was then that I realized that we need a new voice in Washington, and I decided then to run for this seat that I will win in November. So he's come a long way, so we need to give him a chance to speak. I want to introduce to you Representative Chris Van Hollen, who was elected to Congress in 2002 in a high-profile election like this one is likely to be. It received also national attention, and he has earned the reputation as an active, engaged, and effective member of Congress. He is an astute lawmaker, the Washington Post says. Really? I am pleased to have him here. He has made a big commitment to be away from his family in a time when he could be home, so that he fights for health care in our state. Please welcome Congressman Van Hollen from Maryland.
Gabe and all of these children and families and all of you in the Show Me State. And we all know that the Show Me State has been a bellwether for the mood of America. It's been an early indicator of how the people throughout this country are feeling. And it's also been a state that has prided itself on looking for practical solutions to issues, especially ways to preserve the American dream for middle-class families. And when we're talking about the issue of health care that Judy Baker has been such a leader on, that is obviously a critical part of helping protect security, economic security for American families, especially at a time like now when so many people are feeling squeezed. They're feeling squeezed when they go to the gas station, they're feeling squeezed with their health bills, and they're working hard to make ends meet. And you would hope at a time like this that leaders in Washington would be able to unite to come up with those common sense solutions like people in the Show Me State want to see. And I can say that the new Congress that was elected in 2006 as a result of the changes pushed by the American people in the last midterm elections, the new Congress hoped very much to be able to work with President Bush and Vice President Cheney on this very important issue of health care, beginning with making sure that more families, working families with children, could afford health care, at the very least to help provide coverage for their kids. And that's why we proposed that we would extend and expand what had been a very successful bipartisan program, created when President Clinton was president, but with the Republican Congress at the time. A program that's been very successful. And after all, President Bush said he wanted to be a uniter, not a divider. He said he wanted to be a compassionate conservative. So we decided to take him up on that proposal. And we passed a piece of legislation. We passed a piece of legislation that would expand coverage under the Children's Health Bill. And unfortunately, when the President and the Vice President had a chance to actually put those words to the test of action, the President vetoed our efforts to expand the children's health. Not just once, but twice. And just to give you an idea of how this program has been working, it covers today, the existing program covers about 6 million children throughout the United States of America, including over 106,000 children here in the state of Missouri. Children like people who are gathered here today. And what we proposed to do was to extend that a little bit more to cover 10 million children around the country. And it would have covered another 57,000 children here in the state of Missouri. These are families who earn more income that makes them eligible for the Medicaid program, so they're not covered there. Just trying to make ends meet. They're out there working every day in their jobs and trying to make sure they also have health care for their kids. And that's what we propose to do. Unfortunately, the incumbent member from this district, who is no longer going to be running for the seat, Judy Baker got it, voted against the Children's Health. He voted with the president and voted veto on the rise. We are so excited that we now have a candidate, a terrific candidate, Judy Baker, who has proven her leadership in this area of healthcare and so many other issues. But as she said, this is an area where she's been especially effective and especially committed. And we're so pleased that she's going to be able to help break that cycle of just saying no to providing children's health and vetoing it and trying to protect the status quo. Because this was an expansion that was paid for. It was paid for in part by eliminating subsidies under the Medicare program to some of the HMOs that didn't need them. And it was also paid for with tobacco tax revenue and other things. So this was paid for in a responsible way. And the president decided to veto it. So we need somebody with the leadership qualifications of Judy Baker. As you know, she's somebody who is deeply rooted in her faith and has taken those values to the Missouri legislature. She didn't mention it, but she passed the Missouri Healthy Missourians Caucus, established that caucus. She's been a leader on school nutrition issues for kids and all sorts of other issues related to health, along with many others. And so that's the kind of leadership we need. So we are so proud of the fact that we have a candidate who is going to work to bring people together in Washington, like we all want to do, around this common sense, show me state type solution